you've been watching, you know that we have promised you David McAtee, Community Relations Specialist for the Yavapai County Community Health Services. We were commenting, for those of you who know Prescott, if you live in Phoenix, you don't know this and you're not even concerned, you'll probably be bored, but they're right around the corner from the AZTV studios. David, 2 months with the organization.
Yes.
And you come to us from?
You worked for the Courier, in local news media in the area, and before that I worked for a financial planner, doing marketing, product promotion, product development, that kind of thing.
So you're coming on to try to help market, I'm assuming,
Yes.
Yavapai County Health.
Yes.
And I think we need that, don't we, David?
Absolutely.
Because we were talking before you came on, a lot of people don't realize all the services that you can provide people.
Absolutely. There's just an enormous amount of programs, opportunities to better yourself. We have an environment health department that does inspections on restaurants. People don't know that that's part of the health department. We also do vector surveillance, which is checking mosquitoes for West Nile. So there's a tremendous service just in that area alone.
Now, I understand with the restaurants, I remember when you gave an A plus B, I think you rated like that. You don't do that rating system as we speak now, do you?
There is a rating system. It's actually about to change a little bit, and possibly in the next couple of months, maybe next year sometime, you'll actually be able to see those reports online. So you'll be able to see.
Well, we still hang them. People hung them in restaurants.
Yeah, you can. You can hang your review in the restaurants.
Yes,
Yeah,
I remember that.
Yeah, we also put out the Golden Plate Awards, which are restaurants that have done really well for a while.
And marketing, you come from marketing to marketing, is
Yes.
how I'm hearing this.
Yes.
And marketing is marketing.
Yes.
The product changes, but so many times the MO stays the same, what you do and how you do it. And when we say Yavapai County, we're saying most of northern Arizona you cover.
It's quite a wide area.
That's huge.
All the way from Chino, Prescott Valley, Cottonwood, part of Sedona. We couldn't afford the whole thing, so we just took part of Sedona. Yeah.
But
you wanted to take
the whole thing.
Yes,
let me
that's
tell
right.
you.
Yeah, it's a tremendous area that's got some quite diverse population.
David, I know there's people in our viewing audience right now that may need a little help. What kind of help can you give those people who may be having trouble economically speaking?
We have, we take all private insurances, first of all, let's just say that. And our medical facility is for everyone, from those with private insurance, those uninsured, people on Access, Medicaid, we take it all. We are one of the few providers in the area that's still taking new patients on Access. A lot of the doctors don't want to take Access, so we are more than happy to do that. But from a non-medical side, we offer several programs. We've got one coming up in September called Arizona Take Charge Challenge. It's a 12-week program, free of charge. Basically what you do is you get 9 of your friends, so groups of 10 or more, and you call Jackie at the health department. Her number is 442-5567, and just sort of RSVP. We're going to have a kickoff on the 8th of September. And what it is basically is you're committing to about 12 weeks of exercise activity, and all we ask is that you tell us you're going to give, for like me personally, I'm doing 20 minutes a day, 6 days a week. That's my commitment. And so at about 6 weeks, they're going to do a drawing.
Who keeps you honest?
Yeah.
Well, that's just it, the group. And really it's sort of a group support program, if you will, and you're going to get 10 of your friends from work, church, neighborhood, wherever you can, and just make yourself a little group.
Are we in charge of our own exercise, or do we do group exercises?
No, you can do it on your own, and exercise differs depending on everybody. I mean, it could be mowing the lawn, it could be taking your daughter for a walk, it could be working out at the gym. It's all up to you. Basically, we're just asking that you commit to do something and then keep track.
You're trying to discipline people into motion.
Exactly. And really if at the end of the 12 weeks you've set habits, kind of created some new objectives in your life and you're active, all the better.
It's great that you have groups of 10 because I don't want 9 people down my throat telling me I'm not doing something and
Well, that is exactly.
bugging me.
Yeah, but they can be there to call
But
you
that's
on
what they're
occasion.
for to
Right,
do.
exactly.
So if
They
you
can
don't
help
want that,
No,
you
don't
stay
want
on
to.
track.
Exactly. So there's a support program.
So you're doing a lot of preventative.
Yeah, absolutely. There was a report that came out a while back. I wrote an article on it about Alzheimer's, and this research is showing that the top 7 factors leading, they believe, to Alzheimer's in the United States, the number 1 is inactivity. So just get up off the couch.
And low B12. That's
Yeah.
coming out too. Low B12s and B12 in the system of people. Now, this is not medical advice. This is not doctor advice. This is just, we're quoting studies here, so please don't hold us to those. So obviously we're talking about overweight or obesity. which is an epidemic.
Yes.
You're going to see more people come to your facility for services with the doctors refusing what they're refusing now, aren't you? Have you seen an increase?
Not really. We haven't really seen an increase.
Are you going to?
I think we are. I really do. And it's interesting because in this country, we are seeing an occurrence of obesity, whereas in other countries, you're seeing malnutrition and anorexia. So these doctors that we have at the county health department are passionate about what they do. They're board certified, so they're very well educated. They're just incredible doctors that have been trained to do a really, really good job.
David, stay with us. A short break. We're going to come back and talk about a little bit about smoking.
But first, Tonya's going to let you know, if you're working in the office right now, any office in downtown Prescott, and you say we're hungry for lunch, where should you go, Tonya?
Just go to another office, the Office Restaurant and Bar, right there on 128 North Cortez. They have a daddy daycare program going on. What it means is, ladies, drop him off at the office. They're going to take care of him. They'll feed him, they'll give him something to drink, and they'll give him TVs to watch. What better deal is that? And you can go spend money and shop. The Office Restaurant and Bar is one of 3 Fork in the Road family restaurants. Murphy's Restaurant, Gurley Street Grill are the other 2.